Medsurg Perioperative Nursing Practice Test Questions. Question 1. In Medsurg Nursing Lecture Perioperative Care, a question focuses on preoperative checklist. Which nursing action is the safest first priority? Option A. Airway recovery, bleeding surveillance, pain control, infection prevention, mobility safety, and discharge readiness. Option B. Finish routine documentation before assessing the patient. Option C. Delay action until every possible diagnosis is confirmed. Option D. Focus only on comfort and ignore physiologic risk. The correct answer is option A. Airway recovery, bleeding surveillance, pain control, infection prevention, mobility safety, and discharge readiness. Because preoperative checklist can become dangerous when early clues are missed, the nurse begins with airway recovery, bleeding surveillance, pain control, infection prevention, mobility safety, and discharge readiness. Strong Medsurg judgment works like a compass in fog, pointing first toward life, safety, and rapid reassessment. Question 2. A student is reviewing informed consent verification under Medsurg Nursing Lecture Perioperative Care. Which findings should be treated as most urgent? Option A. A stable patient asking for a warmer blanket. Option B. Airway compromise, bleeding, hypotension, fever, severe pain, wound drainage, or declining level of consciousness. Option C. A routine question about meal timing. Option D. A calm patient with no change from baseline. The correct answer is option B. Airway compromise, bleeding, hypotension, fever, severe pain, wound drainage, or declining level of consciousness. Because urgent findings threaten oxygenation, circulation, neurologic status, or organ function, the nurse responds before the problem grows teeth. In Medsurg care, the quiet early warning is often the secret that prevents a crisis. Question 3. Which response best shows clinical judgment when managing NPO status? Option A. Rely on one normal value and stop monitoring. Option B. Use the same plan for every patient without reassessment. Option C. Compare current findings with baseline trends and escalate meaningful changes. Option D. Avoid asking the provider questions. The correct answer is option C. Compare current findings with baseline trends and escalate meaningful changes. Because patients are moving stories rather than frozen pictures, trends reveal direction and speed. The nurse who compares, questions, and escalates is not overreacting, that nurse is protecting the future. Question 4. Which nursing action should be avoided during care for surgical site marking? Option A. Rechecking vital signs after an intervention. Option B. Communicating a sudden change during handoff. Option C. Teaching the patient what danger signs to report. Option D. Ignoring new symptoms because the patient looked stable earlier. The correct answer is option D. Ignoring new symptoms because the patient looked stable earlier. Because earlier stability does not guarantee current safety, ignoring new symptoms is like driving with yesterday's weather report. Medsurg nursing demands fresh assessment for fresh decisions. Question 5. Which patient teaching point is most important for preoperative medications? Option A. Explain warning signs, medication safety, follow-up care, and when to seek urgent help. Option B. Tell the patient to stop all prescribed care once symptoms improve. Option C. Encourage the patient to share prescriptions with family. Option D. Tell the patient that follow-up is never necessary. The correct answer is option A. Explain warning signs, medication safety, follow-up care, and when to seek urgent help. Because discharge is not the end of nursing care, teaching gives the patient a map for the road home. Good education turns fear into a plan and prevents avoidable returns. Question 6. Which outcome best shows improvement in anesthesia risk? Option A. A more attractive room setup. Option B. Stable vital signs, improving symptoms, safer laboratory trends, and better function. Option C. More visitors at the bedside. Option D. The patient asking fewer questions. The correct answer is option B. Stable vital signs, improving symptoms, safer laboratory trends, and better function. Because true improvement appears in the body's evidence, the nurse looks for safer trends instead of surface comfort. Recovery leaves footprints in vital signs, symptoms, labs, and function. Question 7. A nurse is creating a care plan for post-anesthesia care. Which goal is most appropriate? Option A. Complete paperwork before any assessment. Option B. Avoid involving the patient in care decisions. Option C. Prevent complications while supporting recovery through focused assessment and timely intervention. Option D. Wait until severe symptoms appear before acting. The correct answer is option C. Prevent complications while supporting recovery through focused assessment and timely intervention. Because Medsurg care rewards prevention, the nurse builds a plan that sees danger early and acts before damage spreads. The best care plan is a shield, not a reaction after the wound. Question 8. Which handoff detail matters most for airway after surgery? Option A. The patient's favorite television channel. Option B. The color of the blanket used overnight. Option C. The visitor's parking location. Option D. Recent changes, current risks, interventions performed, and patient response. The correct answer is option D. Recent changes, current risks, interventions performed, and patient response. Because handoff is where patient safety can either travel or disappear, the nurse shares what changes the next decision. Clear report keeps the patient protected when one caregiver passes the torch. Question 9. Which action best prevents errors during pain management care? Option A. Verify orders, assess contraindications, monitor response, and clarify concerns. Option B. Assume every order is safe without checking. Option C. Skip reassessment after medication administration. Option D. Document a response that was not assessed. The correct answer is option A. Verify orders, assess contraindications, monitor response, and clarify concerns. Because safe care is built from verification and follow-through, the nurse treats each intervention as a promise that must be checked. Accuracy is not slow, it is how speed stays safe. Question 10. Which statement by the patient shows a need for more teaching about wound assessment? Option A. I will ask for help if symptoms suddenly worsen. Option B. I will wait several days before reporting serious warning signs. Option C. I will take medicines exactly as explained. Option D. I will keep my follow-up appointments. The correct answer is option B. I will wait several days before reporting serious warning signs. Because waiting can turn a manageable problem into an emergency, the nurse corrects any belief that delays help. The most valuable teaching is the sentence that makes the patient act in time. Question 11. For surgical site infection prevention, which assessment should the nurse prioritize? Option A. Only the patient's preferred meal. Option B. Only the room temperature. Option C. Focused assessment of the body system at risk plus vital signs and mental status. Option D. Only the time of the last visitor. The correct answer is option C. Focused assessment of the body system at risk plus vital signs and mental status. Because focused assessment reveals whether the threatened system is holding or failing, the nurse gathers data that can change care. Assessment is the radar that sees danger before it reaches the bedside. Question 12. Which complication should the nurse watch for with deep vein thrombosis prevention? Option A. Temporary boredom during hospitalization. Option B. A harmless preference for a different pillow. Option C. A routine dislike of hospital food. Option D. Deterioration involving perfusion, oxygenation, infection, bleeding, or organ function. The correct answer is option D. Deterioration involving perfusion, oxygenation, infection, bleeding, or organ function. Because Medsurg complications often spread from one system to another, the nurse watches for the pattern that threatens survival. Catching the first falling domino can save the whole line. Question 13. Which delegated task is safest for an assistive team member during intensive spirometry after surgery care? Option A. Collect routine vital signs and report abnormal findings immediately. Option B. Interpret unstable assessment changes independently. Option C. Change high-risk medication doses. Option D. Decide whether rapid response is needed. The correct answer is option A. Collect routine vital signs and report abnormal findings immediately. Because delegation should extend the nurse's reach without handing away clinical judgment, routine data collection is appropriate when reporting rules are clear. Teamwork works best when everyone knows the danger line. Question 14. A patient with early ambulation suddenly seems confused. What should the nurse do first? Option A. Assume confusion is normal and leave the room. Option B. Assess oxygenation, perfusion, glucose risk, medication effects, and neurologic status. Option C. Wait until the next shift to reassess. Option D. Offer entertainment before checking safety. The correct answer is option B. Assess oxygenation, perfusion, glucose risk, medication effects, and neurologic status. Because new confusion can be the brain reporting poor oxygen, low perfusion, infection, or metabolic trouble, the nurse treats it as a clinical alarm. The mind often speaks for the body before the body collapses. Question 15. Which documentation is strongest for postoperative bleeding? Option A. A vague note saying the patient seemed fine. Option B. Only personal opinion without data. Option C. Objective findings, time of intervention, patient response, teaching, and notifications. Option D. A copied note from a different patient. The correct answer is option C. Objective findings, time of intervention, patient response, teaching, and notifications. Because documentation is the memory of care, it must show what happened and how the patient responded. Strong charting protects continuity, accountability, and the next safe decision. Question 16. Which question best tests understanding after teaching about urinary retention after surgery? Option A. What color was the hospital wall? Option B. Which nurse entered the room first? Option C. What meal did another patient receive? Option D. What symptoms would make you seek urgent help after discharge? The correct answer is option D. What symptoms would make you seek urgent help after discharge? Because teachback reveals whether information became usable action, the nurse asks the patient to explain warning signs. Understanding is proven when the patient can carry the plan outside the hospital. Question 17. Which action best supports safe medication use in ileus prevention? Option A. Check indication, allergies, labs, vital signs, interactions, and patient response. Option B. Give medication first and ask questions later. Option C. Ignore lab values before high-risk medication. Option D. Use another patient's medication if the drug name matches. The correct answer is option A. Check indication, allergies, labs, vital signs, interactions, and patient response. Because medication can heal or harm depending on the patient's current state, the nurse connects the order to real-time evidence. Safe medication practice is clinical reasoning in motion. Question 18. A patient asks why repeated assessments are needed for nausea after anesthesia. What is the best explanation? Option A. Repeated checks are only for paperwork. Option B. Your condition can change, so repeated checks show whether treatment is working. Option C. The team does not trust the patient. Option D. Assessments are done only because the room is available. The correct answer is option B. Your condition can change, so repeated checks show whether treatment is working. Because illness changes over time, reassessment tells the nurse whether the plan is helping, failing, or causing harm. It is the feedback loop that keeps care honest. Question 19. Which priority framework best applies to drain care? Option A. Alphabetical order of tasks. Option B. The easiest task first every time. Option C. Airway, breathing, circulation, safety, then targeted disease needs. Option D. The task requested by the loudest person. The correct answer is option C. Airway, breathing, circulation, safety, then targeted disease needs. Because priorities must protect life before routine comfort, the nurse uses a framework that keeps decisions disciplined. ABCs are not just letters, they are the order of survival. Question 20. Which family comment should the nurse address during dressing changes care? Option A. We want to understand the warning signs. Option B. We will help track follow-up appointments. Option C. We will call if the nurse told us it is urgent. Option D. We thought new severe symptoms could wait until tomorrow. The correct answer is option D. We thought new severe symptoms could wait until tomorrow. Because family beliefs shape what happens after discharge, the nurse corrects dangerous delays. Teaching the family is like placing a second safety monitor at home. Question 21. Which action shows patient advocacy during sterile technique? Option A. Question unsafe changes and speak up when assessment data show risk. Option B. Stay silent to avoid bothering the team. Option C. Hide abnormal findings to keep the unit calm. Option D. Let confusion continue without assessment. The correct answer is option A. Question unsafe changes and speak up when assessment data show risk. Because advocacy means protecting the patient when risk appears, the nurse uses evidence and communication to keep care safe. Speaking up is not conflict, it is professional courage. Question 22. Which infection prevention step matters in discharge teaching care? Option A. Skip hand hygiene when the patient looks clean. Option B. Use hand hygiene, appropriate precautions, clean equipment, and patient education. Option C. Share supplies between rooms without cleaning. Option D. Ignore isolation instructions to save time. The correct answer is option B. Use hand hygiene, appropriate precautions, clean equipment, and patient education. Because infection can turn recovery into a setback, prevention must be routine and deliberate. Clean practice is one of the quietest ways nurses save lives. Question 23. Which sign would support calling rapid response during fall prevention after anesthesia? Option A. A request for a second blanket. Option B. A preference for a different snack. Option C. Sudden instability in airway, breathing, circulation, mental status, or perfusion. Option D. A routine question about visiting hours. The correct answer is option C, sudden instability in airway, breathing, circulation, mental status, or perfusion. Because rapid response is designed to bring help before collapse, the nurse calls when vital systems begin to fail. Early escalation is a mark of skill, not panic. Question 24. Which statement best fits exam preparation for malignant hyperthermia? Option A, choose the longest option every time. Option B, choose the option that delays all intervention. Option C, choose the option that ignores assessment data. Option D, choose the option that protects life first and then addresses the specific disease process. The correct answer is option D, choose the option that protects life first and then addresses the specific disease process. Because strong exam reasoning mirrors bedside reasoning, the safest answer protects life and uses the disease clues. The secret is not memorizing words, it is seeing the priority behind them. Question 25. What is the best overall nursing mindset for timeout procedure? Option A, stay calm, assess deeply, act early, communicate clearly, and reassess often. Option B, assume the first plan always works. Option C, ignore subtle changes until they become severe. Option D, focus on tasks without thinking about risk. The correct answer is option A, stay calm, assess deeply, act early, communicate clearly, and reassess often. Because Medsurg nursing is a balance of watchfulness and action, the nurse must think while moving and reassess after acting. The best nurse is calm enough to notice and brave enough to respond.